What's going on, everyone, and welcome to this video today. Today we're going to talk about something that's bothering a lot of people, including myself. The president said something during his State of the Union address on Tuesday that really it was pretty far out there. I want you to first see the clip of what he said. I think you know what I'm leading up to. There you go.
COVID had shut down, our businesses were closed, our schools were robbed of so much. Today, COVID no longer controls our lives.
All right. He has said multiple things here that are just startling. COVID no longer controls our lives? Schools have been robbed of so much. Businesses have been shut down. I can prove this is still an issue. Let's just start off here with the numbers. 54,306 new cases yesterday. 462 new deaths yesterday. 30,892 people in the hospital. 3,774 people in the ICU. All right, let's go metric by metric. So 54,000 people tested positive yesterday, right? That's 54,000 people that are going to have their lives disrupted for the next 5 to 10 days, if not much longer than that. CDC guidance says, oh, you're good to go in 5 days. As you know, it can take multiple weeks to get better, and some people then go on to get long COVID, some get hospitalized. Well, heck, 30,892 people are still in the hospital, and for some people it gets even more severe, where they end up in the ICU. 3,774 people are experiencing that. And yeah, a hospitalization from COVID, if you don't have really good health care, which a lot of people don't, can get very expensive. And that's a bill you cannot afford. 462 people died yesterday. We are still averaging over 3,000 deaths a week. I believe last week was about 3,700 deaths. Yeah, you're talking loved ones being taken away from families. In some cases, it's young people. In some cases, it's older people. When it's young people, they may be married couples who have a family, who have kids. Let's just say a father passes away. The mother is then left to take care of the kids and work a full-time job at the same time. That becomes very costly. They have to have an income, and one-sided income is not good enough because, as you know, everything's expensive as heck right now with inflation. So they just lost a second source of income. Who's going to watch the kid while the mother's at work and the kid comes home from school? Well, then you have to pass that on to another family member, maybe an extended relative or a friend. Yeah, their life is clearly still being controlled by the pandemic, because if the family member, being the father or the mother, whoever passed away, was still living, they would not have this issue. Let's go back to 54,306 people testing positive yesterday. Guess what's the problem with that? Some of them go on to get long COVID. More on long COVID in a minute. Staffing shortages. Biden mentioned schools. Kids were robbed. Guess what? Kids are still being robbed. U.S. schools in staffing crisis mode as clinicians' demand intensifies. Guess what? Here's the issue with this. The issue with this is that when you come to schools and you have less teachers, you have more kids in a class. When you have more kids in a class, it results in less attention from the teacher. When you have less attention from the teacher, the kids aren't learning properly. So yes, the kids are being robbed of a proper education, and there really is no plans to fix this, as the ultimate solution of hiring more teachers is not a viable option because, one, teachers don't get paid enough, and two, some are very high risk and cannot afford to get a COVID infection, and as we know, schools are breeding grounds for viruses. Alright, moving on to long COVID. Nearly 36 million Americans who tested positive for COVID-19 report having long COVID symptoms, including more than 40% of people in Mississippi. 40% of people who had COVID in Mississippi. This is a real problem. Long COVID can cause an array of health issues, some which get severe enough that people have to lose their jobs. They have to leave their jobs. And when they leave their jobs, they're not making income. They can try and file for disability, but it's hard for some people to get on disability. And some people are having to sell their houses because they cannot afford them anymore. and then they have to move in with family members. And this is a real issue. This is an issue that's not being addressed enough, not nearly enough. And here's the problem with this. For these 36 million people, COVID is still controlling their life. That's a huge number of Americans. Let's continue on here. Here we go. Tim Kaine pushes for long COVID solutions. So there's finally maybe a push to do something about long COVID. The first long COVID summit in the country to bring a U.S. senator, federal health officials, state providers, and patients together was held in Richmond last Friday. So that's a good thing. At least we're going to try and do something about it. Is it enough? No, it's not nearly enough. How about court trials? Are they still being affected by the virus? You better believe they are. Second juror let go in householder trial amid COVID outbreak, raising specter of mistrial if illness spreads. This is in Ohio. So there's a big trial going on in Ohio. It has been stopped multiple times because of COVID cases. Yeah, COVID's still controlling court cases. Let's continue on to this. Mask mandate New York tweeted this today. New York State is ending the mask mandate in medical settings on February 12th. And they went on to say in a second tweet, we just learned from a colleague that it was announced at PHHPC meeting this morning, and we just called and confirmed with New York State Health Commissioner's office. So, New York State is going to end the mask mandate in health settings. What does this mean? Well, you have a lot of high-risk people that need to get to medical appointments. You have a lot of different people that need to get to medical appointments. And if it's not safe to do so because people are not masking, guess what? They're unable to get their treatment that they need. And this further worsens their conditions and harms them. Because, listen, folks, masking in medical settings is crucial. When you have people that are high risk for coronavirus and they can't attend their appointments, like I just said, it further makes their conditions worse. And by not masking, it makes things very high risk. Masking is critical in health care settings, and with the virus continuing on, guess what? Yeah, it's another example of COVID controlling their lives. How about airlines? Airlines have just been a disaster. We had the big computer failure back at Christmas time. Now we have the big staffing shortage, which has been going on since the start of the pandemic. Staffing shortages continue to get worse. It really got exacerbated when things opened back up because people started flying again. And guess what? You have pilots that have long COVID. You have pilots and stewardess that do not want to come back to work because of the risk of COVID. So yeah, in the airline sector, it's still being controlled by the pandemic. So yet again, another case where it's still being controlled. How about healthcare? There's a huge staff shortage in healthcare. A lot of healthcare workers are just totally stressed out. Some of them have long COVID. Some of them are high risk, don't no longer want to work in the healthcare sector and are looking for new careers. It's just a disaster. And there are long wait times. At hospitals, there are long wait times to get proper care from specialists, doctors. I mean, the long wait times in the ER are a major problem. Why? Because COVID still exists. You still have the influx of COVID patients coming in. And that's an extra number of people coming in on top of all the other stuff. Respiratory illnesses, heart attacks, respiratory emergencies, strokes, accidents. You know, people get injured when there's an accident. People falling off a ladder. All these different types of things that happen. There's dozens and dozens, if not hundreds, of different scenarios where you need to go to the hospital. And because of this, adding in COVID, you still have long wait times. So yes, COVID is controlling the wait times in healthcare for a number of reasons. Folks, it's simple here. The pandemic has not ended. The virus has not gone away. The virus is not going to go away. Could things get better with the virus down the line? Yes. If we get better treatments, better tools, the virus could get better. And things could get better where we can manage some of this stuff. But right now, folks, we are not at this point yet. We are still in the middle of this pandemic, and it is still bad. it is still controlling our lives. The second someone tests positive, their whole life gets altered. Maybe they had plans to go to a wedding. Maybe they had plans to go to something very important. Maybe they're starting a new job. Maybe they're working at a job. The second they test positive, that gets changed, and it controls their life. They're not able to work. They're not able to make an income. A lot of people who work do not get sick leave. We're just now starting to see the railroad industry finally get paid sick days. See, CSX, for example, did not have paid sick days up until just about a week ago. This is a huge problem. We need to deal with this. We need to stop pretending that the pandemic is over, and we need to face reality that it is still controlling our lives. Alrighty, thanks for watching this video. If you enjoy the content that I provide, hit the like and subscribe button down below. Take care, stay safe everyone.